Breast cancer, the most common type of cancer in women, will touch many of our families, our mothers, our sisters, wives, daughters. In fact, about 1 in 8 women will develop breast cancer in her lifetime. Not only is breast cancer prevalent, it's expensive. It's the single most expensive cancer. In 2012, our nation spent $16 billion on breast cancer. The good news is that 85% of women are surviving breast cancer, thanks to decades of sustained investment in cancer research. Even better, researchers around the world are working feverishly to increase the effectiveness of treatments and to reduce the side effects from treatments. To do this, researchers will need tools in order to develop and test new personalized treatment strategies that are tailored to the unique features and needs of individual women. However, today, many of our best tools are based on the concept of a standard woman, which is at best, as you can see, a rough approximation. And at $30,000 per tool, these are unaffordable in many cancer research laboratories. So in the next few minutes, we'll hear about how artists and researchers have come together to try to overcome some of the limitations of the standard female phantom. More specifically, we'll see how this team is working to create personalized phantoms that accurately model the female breast and surrounding tissues. We'll use 3D scanning and printing technologies to do this. But first, a quick review on cancer therapy. Cancer treatments really fall into 2 categories: local treatments, including surgery and radiation therapy, and systemic treatments, which include chemotherapy. The local treatments are usually used for large tumors, and the systemic treatments for microscopic or small tumors. Doctors use variations on these basic treatment techniques, often in combination, depending on the cancer type and other factors. Radiation therapy is safe, effective, and importantly, it's non-invasive. It's so useful, in fact, that about half of all cancer patients in the United States will receive radiation therapy at some point in their treatment. Now let's take a look at some of these exciting new 3D scanning technologies that are coming out. You see an image of a commercial whole-body 3D scanner using laser light to make rapid measurements of the dimensions of the body. These scanners are used in the motion picture industry and in the textiles industry in order to make quick measurements of the body in order to facilitate making personalized costumes and garments. I got very excited when I saw these new technologies coming out because I recognized instantly that we could use these right off the shelf in cancer therapy. We all know that the female anatomy varies strongly from one woman to the next, even in healthy women of the same age. In cancer patients, we see additional variations due to the presence of tumors, surgical resections, and surgical reconstructions. For all of these reasons and other reasons, breast cancer patients are prime candidates for a highly personalized treatment approach. We use powerful imaging techniques in order to plan personalized treatments. The objective of a radiation therapy treatment is to focus radiation on the tumor and to avoid the normal tissues like the heart and the lungs. To do this, we use powerful imaging techniques like positron emission tomography and CT scanning, computed tomography scanning, and a combination of these images is seen here, clearly revealing the tumor as well as the normal tissues. Once the plan is complete, but before the patient arrives for treatment, we like to make confirmatory measurements to make sure that the treatment will be delivered in a safe and effective manner. Oftentimes, we use a simple water box phantom in which to measure the radiation dose, particularly if we're interested in the performance of the treatment unit. Other times, we use a human-like phantom and measure the radiation dose inside the phantom. Here you can see one of our standard phantoms being assembled by our graduate students in preparation for a measurement out at the clinic. Can anyone guess what the blue piece is on the table? Well, at left you see the assembled phantom, which resembles an adult male phantom of standard dimensions. That blue piece was a female breast accessory. And so by adding a couple of breast accessories, we can convert our standard male into a standard female. And then we could scan the phantom, and you can see a result of that scanning here. We could print up a 3D phantom, and problem solved, right? No, not quite. Remember, we wanted to create a personalized phantom that would more accurately model the actual patient who's going to be under treatment, and then to use that personalized phantom to make our confirmatory measurements. So we're not going to do this. What are we going to do instead? Our next step was to find some experts here on campus who know how to do 3D whole body scanning. You can see two of our collaborators here along with their 3D scanner. This type of device uses visible light and captures simultaneously hundreds of photographs. That process takes about a second. Then, using the wonders of computer science and mathematics, the data from these photographs is synthesized into a full three-dimensional map of the surface of the whole body. And this is an important technology for us to have, because those gold standard imaging techniques like PET scans and CT scans that you saw before, they have some limitations. They're slow to acquire, they cause radiation exposure to the patient, and they're very expensive. So this neat new 3D scanning technology overcomes these limitations. Our next task was to find a healthy subject to serve as our test case, and we had several volunteers from the art community step forward to help us out with this. Here you can see one of our volunteers being 3D scanned. This next image shows you a picture of the surface map as the data are coming in. So as we acquire more and more data, the image becomes more complete and more accurate, and eventually we have a full 3D surface map of the chest. Once this is done, we convert the 3D map into a set of printing instructions. We send that off to a giant printer, and this printer can print phantoms in virtually any size. The phantom at left is in miniature, and the gray phantom that you see is actually larger than life. So we're getting a lot closer now, aren't we? Are all of the problems solved? Not quite yet. These phantoms, which took more than a day to print each, are hollow. We're still working on technologies to accurately and quickly print the internal anatomy. Another problem that we face is that a woman standing in a position much like I am now, her breast takes a very different shape than it does in a treatment position. Here you can see two of the most commonly used treatment positions for breast radiotherapy. Basically, a woman lies on a special treatment couch, either face up or face down. So you can imagine that scanning the breast in a very confined space like this in a medical environment presents some additional challenges. But we're working on those, and I'm confident we'll solve those. Here's a preliminary result, which we took a few weeks ago, and this gives us confidence that we'll be able to solve this problem fully. And with some help from our clinical colleagues out at the Cancer Center, we'll be able to print the internal anatomy as well. As you might imagine, 3D printing and 3D scanning have the potential to revolutionize entire industries, including cancer research. I'm optimistic that these technologies and other transformative technologies will allow us to increase the survival rate for breast cancer patients from the 85% value today to nearly 100% in my lifetime. To be sure, this will take a lot of time and effort, new ideas, resources, but we'll get there. In looking back at this project and in preparing for this talk, I asked myself, how did this unlikely project come into being? Turns out it started with a single chance encounter. Someone from the community reached out to us with a question about breast cancer research. This led to a single donation from a charitable cancer foundation in town here, and that triggered a chain reaction of new ideas and collaboration that spread across the campus and beyond. For me personally, being involved in this collaboration has been both inspiring and just terrific fun. We will win this battle against breast cancer, and we will win it by working together. Students, professors, artists and researchers, volunteers, and donors. So let's keep listening and talking and working together and grow this chain reaction of progress. Thank you.